Yeah. Okay. Good morning, dear friends. We slept well? Unfortunately, as you might know, we thought this training was going to run Monday, Tuesday, Wednesday, so I made plans to travel back this morning, knowing that we would have finished the training yesterday. But please allow me to sincerely thank you for accepting. I want to assume you all accepted to serve on the boards of the facilities represented here. And really, I just take it from me and my very sincere commitment to work with you and your management teams to see us grow these institutions to the next level. I share with my colleagues here, Father Francis and maybe Lorraine, and maybe Sister, and she knows how my thoughts is really, Sister Josephine, yes, that really it is my desire that we sustain the services of the church. It is always my joy to walk into those facilities and see the outpatients full and the wards full of patients. Because people in the communities are sick. If your outpatient is empty, it means you're not able to attract them, you're not able to retain them. And of course, it affects our evangelization. Evangelization is that having to interact with the communities through service in healthcare. So if the people are not coming to us, then we really are not fulfilling our reason for being in healthcare as the Catholic Church. So I just want to encourage you to continue with, of course, the Catholic identity. And if you're serving people with the heart of Christ, for sure, the customer service we are talking about is even a shadow. So just to encourage also our staff to identify with our missions, with our visions, so that they can want to live it day by day, even when they are not being supervised. That the interactions with the patients are those that leave the patients touched and wanting to come back when they have a need for healthcare. So I think I've enjoyed my stay in Kisumu. I've enjoyed interacting with you. And I can tell you for a fact, the members represented here are the best I've interacted with in terms of service to Catholic hospital boards. And I'm not saying because you're here. I've sat with some of you in other forums and I didn't say that. So I have a lot of hope that the next phase, you have a new, actually, even new leadership at the top in terms of the new Archbishop. Father is not very old in the office of the medical coordinator and is part of all of you. My hope is we take our institutions to the next level. Of course, the administrators know what to come to our office for. We are always happy to support. We'll continue to collaborate with CRS and all of you to undertake the next steps in terms of the plan there is with the project CRS is implementing here. That is the development of the policies and then the quality improvement plans for the facilities in Kisumu County. The other thing that I was supposed to speak to is our partnership with NHIF. NHIF is the biggest health financing partner in the health sector in the country. So I'm just asking maybe our facilities to make sure that their claims, of course, are claimable, documented very well, work with your doctors, those that have theaters, so that the notes are precise. If it is a cut, let the dimensions be put, because sometimes a major procedure will be classified as minor because you did not provide a lot of details. So you end up being underpaid. So you get what they call an under approval. You ask for 80, they approve 40 because you did not, it's documented, they can't quite picture the dimensions or the size or the magnitude of the surgery that was undertaken. So documentation, so that even if they come to the ground, the dimensions are carefully documented, the details, all the required details are carefully documented. The other thing, of course, where the board can play a role is in popularizing your services so that members of NHIF can come and seek services in our facilities. As we partner with the schools, there are many schools in this region. Those that are in your catchment, make sure that the edu-afia is capitated to you. Make sure that even the teacher scheme, they seek services from your facilities. Just that nice partnership, respond to their needs. If they ask you to send a clinician to the school instead of the students coming to the school because it's, of course you understand it's time consuming, please facilitate that. Also, when you mobilize, some teachers even have as many as 100 teachers, some schools. Have them seek services and their families from your facilities. The same with the uniformed forces, the National Police Service, their families. Let them seek services from our facilities. But the catch is when they come, let them see the good service that you're marketing to them about. Don't talk about A1 service. When they come, they find a 3B service. So let's tie what we are marketing to the actual service that people get. Service with dignity is good customer service. As long as you appreciate and serve the people walking through your doors, whether they are poor or rich, or they are dressed well or not, they are wearing designer clothes, or they are not looking so neat, service with dignity is what constitutes good customer service. Actually, it's more sustainable to focus on a service with dignity than focusing on just customer service. Because I can pretend and smile, but deep down, I actually don't want to serve you. But when I serve with dignity, then even the customer service is taken care of. It takes care of the sustainability aspect. I think is also to ask all of us to assist and work with the facilities. I can tell you patience is about the experience. Having the numbers is about the experience they get. It doesn't matter how many public facilities are across the road and how free they are. People will come to you if you're serving them well, if they are assured of the quality of your drugs, and that is what will happen. We got feedback from the region. I sit in the board of MEDS, as I mentioned, and of course MEDS is co-owned by KCCB and CHAC. And you have a regional branch here. Continue to give feedback. Their drugs are, we have the quality control lab, WHO pre-qualified. If you go to the market, you're not sure how these people are sourcing their medicines, the quality of their medicines. But you can be sure the drugs being sold at MEDS have been taken through a rigorous quality control process, to a point where we established a head of quality services as part of the management committee, as the top leadership at MEDS. So for me, it's just to also quality, quality, quality. And quality is also, even as you look at quality issues, is the overarching issue is serving our patients, serving our communities with dignity. I have seen instances where maybe I talk to them a lot, the administrators, the ones running the facilities know. Somebody is worried that there's too many facilities, private and public, that have come up around them. Will we sustain our services? And I can tell you, those that have focused on ensuring that they handle their patients with dignity, even if the facilities come up, sometimes they will go a bit for 1 month and then they realize what is being marketed there is really not the real deal, and they'll come back. So let's focus on service with dignity to our people. Let's look at how do we get on board more people coming to our facilities, both for preventive and for curative and rehabilitative services. So I think that is what I can share for now. And I want to wish you well and enjoy the rest of the day. You're going to be in the able hands of our brother and sister from the county government of Kisumu. And Father Vincent is going to be sharing on the canon law provisions, even as we manage Catholic health institutions, so that also we are fully aligned. I think we agreed we are on a delegated role, and the intention really is to ensure that our services are accessible to the people in a way that, of course, is fully aligned to the provisions of the Catholic Church. So I will have to leave, but I wish you well. I've enjoyed being with you. It has been a pleasure knowing you, and I hope to meet you, of course, even at the facility. And even as we engage on the next steps of CRS, I hope our office is going to be fully engaged, and we are going to continue interacting. And the intention is in 3 years, let us look back and say we have made great milestones in terms of impacting the healthcare services where we are serving. Thank you so much, and God bless you all.